Welcome to MenZone, your dedicated space for exploring the evolving landscape of mental health. In 2025, mental health is at the center of a global conversation. We're realizing mental health is essential for everyone, a fundamental human right. The events of the early 2020s, a period marked by unprecedented challenges, didn't start the crisis, but they made it impossible to ignore. Now, more people are speaking openly about anxiety, depression, and burnout. This openness is exposing how unprepared our systems are to meet the growing demand for mental health care. The cost of ignoring mental health is higher than ever. We're shifting from crisis management to building resilience and promoting well-being. This isn't just a medical issue, it's social, economic, and deeply personal. The stakes are high. Inaction means more suffering and fractured communities. This video explores where we are, how we got here, and what we can do next. Let's get serious, because your mental health is your greatest asset. The numbers are staggering. They paint a picture of a global challenge that touches almost every corner of the world. We're not just talking about isolated incidents, we're looking at a widespread issue that demands our attention and action. Nearly 1 in 4 people worldwide. Think about that for a moment. That's a significant portion of the global population will face a mental health condition at some point in their lives. It's a reality that's far more common than many realize. That's not them. It's not some distant group of people we can't relate to. It's us. It's a reflection of our shared human experience. Our families, our friends, our neighbors, our colleagues. It's the people we interact with every single day. Depression and anxiety in particular are leading causes of disability worldwide, impacting individuals across all ages and demographics, robbing people of their potential, hindering their ability to contribute to society and live fulfilling lives, and quality of life. It affects their relationships, their careers, and their overall sense of well-being. Young people are especially at risk, facing unique pressures and challenges in today's world. With rising rates of mental health issues, anxiety, depression, and self-harm, creating a growing crisis that needs immediate attention. Frontline workers, those who dedicate their lives to serving others, healthcare professionals, first responders, educators, are facing immense pressure and stress, are burning out at unprecedented rates, struggling to cope with the demands of their jobs. Poor mental health isn't just personal, it doesn't exist in a vacuum. It ripples through every aspect of our lives, workplaces, families, and entire economies, creating a domino effect that impacts us all. The global economy loses a staggering amount of money, over $1 trillion each year, a financial burden that affects everyone. To lost productivity, absenteeism, and decreased innovation. From depression and anxiety, these conditions significantly impact the workforce and the economy as a whole. Investing in mental health services and support is both the right, ethical, and compassionate thing to do, and the smart thing to do from an economic and societal perspective. These statistics represent real people. They are not just numbers on a page. Students striving for their dreams, parents raising families, elders sharing their wisdom, struggling every day with the weight of mental health challenges. A healthy society is one that supports everyone's well-being and potential, ensuring that no one is left behind. Acknowledging the scale of the problem, recognizing its widespread impact, is the first step toward real change, toward creating a more supportive and understanding world. We have a long way to go on this journey, but awareness is growing, and with it, the hope for a brighter future. If mental health matters, why is care still so hard to access? Stigma remains a huge barrier. People fear judgment and isolation. Cost and lack of insurance coverage keep quality care out of reach for many. There's a global shortage of mental health professionals, especially in rural and low-income areas. But new solutions are emerging. Telehealth and digital platforms are making therapy more accessible and affordable. Apps for mindfulness and CBT offer low-cost support, and peer-led community programs are growing. Integrating mental health into schools, workplaces, and primary care is breaking down barriers. We're moving from crisis response to proactive, accessible care for all. Mental health treatment is evolving fast in 2025. Personalized medicine uses genetic testing to match people with the right treatments, reducing trial and error. Digital therapeutics, clinically validated apps, deliver evidence-based care for conditions like insomnia and anxiety. Psychedelic-assisted therapy, under strict clinical protocols, is showing promise for treatment-resistant conditions. Neuromodulation techniques like TMS are becoming more targeted and effective. These innovations expand our toolkit, offering hope to those who haven't found relief before. The future of mental health care is more personalized, accessible, and effective. New tools mean more people can find a path to healing. The old divide between mind and body is finally breaking down. Mental and physical health are deeply connected. Stress and depression worsen physical illness and vice versa. Integrated care means mental health professionals work alongside primary care doctors. Routine checkups now include mental health screenings, making support easier to access. Patients get immediate help without the stigma or hassle of navigating separate systems. This approach leads to better outcomes, higher treatment adherence, and improved quality of life. It's also more efficient and cost-effective for healthcare systems. In 2025, whole-person care is the new standard. The future of medicine is treating the mind and body together. True health means supporting every part of a person's well-being. Real change happens beyond the clinic, in policy, activism, and culture. In 2025, advocacy is louder and more organized than ever. The fight for mental health parity is closing insurance loopholes and demanding fair coverage. Public investment is growing, with more funding for community mental health centers and crisis response teams. Cities are deploying mental health professionals instead of police for crisis calls, leading to safer, more compassionate outcomes. High-profile advocates are sharing their stories, breaking stigma, and inspiring millions. Policy reform and public activism are working together to drive progress. The movement for mental health as a human right is gaining unstoppable momentum. As we move into 2025, we find ourselves at a crucial turning point in our understanding and approach to mental health. Progress is real. We're seeing more open conversations and a growing awareness of the importance of mental well-being, but challenges remain. Many individuals still face significant hurdles in accessing the care they need. The conversation is open, and people are increasingly willing to share their experiences and seek help. New treatments are offering hope, providing more effective and personalized approaches to mental health care. Integrated care and policy change are making a difference, but access is still unequal and stigma persists. We must address root causes, the underlying factors that contribute to mental health challenges. Poverty, discrimination, trauma, not just symptoms. We need to focus on holistic solutions that address the whole person and their environment. Looking ahead, expect more data-driven care and a focus on prevention. The future is about building mental wellness for all. Your voice and actions matter. Educate yourself, support others, and advocate for change. We're all in this together. By working together, we can create a future where mental health is valued and prioritized. Share your thoughts below. Like and subscribe for more real talk on mental health. Let's build a future where everyone can thrive.